The Big WECK presents Buffalo on the Rise, sponsored by Dr. Kaplansky Dental Implants. Get new permanent teeth in 24 hours with our exclusive Teeth Now process. Welcome to the television show devoted to local business, Buffalo on the Rise, with your host, Joe Chili. There's an entrepreneurial spirit in Western New York that's putting our area on the cusp of greatness. Each week, Buffalo on the Rise features local business leaders and decision makers who are shaping our future. If it's about local business, we'll talk about it right here, right now, during Buffalo on the Rise.
I'm Joe Chili. On this edition of the Big WECK's Buffalo on the Rise, I'll introduce you to some hometown leaders of local businesses here to help you and your family. Like Aaron Polanski from Living Legends Health, operating 5-star rated McGuire Group and Absolut care facilities, with information on post-acute rehabilitation, skilled nursing care, and assisted living for you or your loved ones. Jonathan McDonnell from Buffalo Advanced Medical Acupuncture, offering alternative methods to reduce your pain and help you feel your best. And with the spring season here, put a little pep in your step with a bright new smile. Dr. Kaplansky is here with a dental procedure to brighten your look. On this edition of the Big WECK's Buffalo on the Rise, stay with us.
Hi, I'm Joe Chili, mornings from 7 to 9 on Buffalo's oldie station, the Big WECK. Joining us on the Big WECK's Buffalo on the Rise today is Aaron Polanski, who is the Vice President of Business Development for the McGuire Group and Absolut Care.
Thanks, Joe, for having me.
Well, thanks for joining us. We really appreciate it. What does the McGuire Group and Absolut Care do, and how do those two portfolios or businesses relate to one another?
Oh, great. So the McGuire Group and Absolut Care are comprised of 8 different skilled nursing facilities across the Western New York region. And we provide post-acute care services, rehabilitative services, skilled nursing, and long-term care services across the Western New York region.
So as far as those services are concerned, how do they impact an individual? Like, these individuals that are just getting out, say, of hospital care, maybe they've just had surgery or something like that, and then they're going to see a group such as yourself?
Yeah, so we provide those services for people, for example, who maybe had a stroke or maybe deconditioning, perhaps a hip or knee surgery, those individuals who need that type of specialized service. We provide an individualized plan of care for each individual who need that type of service in our facilities. So when they come into our facility, one thing they'll see, right? They'll receive physical therapy, occupational therapy, and speech therapy services. We also have 24-hour nursing services around the clock, and we also have physicians and nurse practitioners on site.
Let me kind of clear up a misconception. If people are trying to figure out where they're going to go for rehab or post-acute services, things like that, do they actually have a choice on where they go?
They absolutely have a choice.
All right, that's something, I thought, maybe they say, your doctor or someone says, you're going to go here, and you just automatically go. You know what I mean? So what about the post-acute rehab programs that you have? What actually is that, if you can explain that to us, and who would benefit from a service like that?
That's a great question, because I think there's a lot of misconceptions about post-acute care rehab. So really, it's a step down from an acute care setting. And we really work with those individuals who are deconditionized, those who have undergone significant surgeries, whether it's chronic care management, perhaps you are in one of the local hospital systems and you need a specialized service, whether that's wound care, whether it's telemetry services. We're able to offer those services at bedside at our facilities.
All right, so it is beneficial. This is something that people, I guess, are really anxious after surgery, something like that. I want to get back to normal. This is America. I want to get back to normal as fast as I can.
Yeah.
But you really do need this post-acute care after a hospital stay, right?
Yeah.
It's something that's very important.
Yeah, to your point, it really is important. So when people are in the hospital for an extended period of time and, they're recovering from serious illness or serious injury, they need time to heal, and it needs to be in a safe environment. So post-acute care rehab creates that environment, right, where people receive 24-hour medical care, right, while working with therapists, while working with physicians, and, they learn techniques, right, that will help them transition safely back into the community.
So, funny things, like when you go back, maybe you have to learn how to walk properly again.
Mm-hmm.
Maybe your balance is off. You know, how do I bend over to load a dishwasher? You
Yes.
know, these may seem like things that are simple and you don't really think about, but you go through these things with people, right?
Yeah, absolutely. I mean, you know, if you've had hip surgery or knee surgery and you need to learn how to get up and down stairs or get in and out of a car, or, you know, working with a speech therapist or an occupational therapist after you've had a stroke, those are important opportunities, you know, important programs that we can offer at McGuire Group to help transition those people back into the community.
And I've got to think that, you know, your therapists have to be very patient individuals to go through things like that
Yep.
with individuals. What do you say sets your facilities apart?
Well, each one of our McGuire facilities are 5-star ranked from CMS, federal government, Medicare and Medicaid. And you know, the reality of it is we strive to be the premier provider in Western New York for post-acute care and skilled nursing services.
And where are your facilities located? Are they all over the Western New York area?
We are in West Seneca, we are in Hamburg, and we're also in Cheektowaga as well.
So where can I go, or where can they go to learn more about a facility or learn more about the group itself?
Good question. So you can visit us on our website at www.livinglegendshealth.com. You can also contact any one of our facilities. We're happy to set up a tour. If, for example, maybe you're in the hospital and you have questions about any one of our services, please reach out to your social worker or your case managers at the hospital. They'd be happy to help, you know, discuss all the services that we have to offer.
I have to give you credit too. I mean, the McGuire Group has been around forever, and Absolut Care, you know, we certainly understand. And the Living Legends Health portion, you know, kind of resonates, you know, with me. I mean, I think of the fact that, you know, I want to be well again. I don't want to think of myself as being an invalid, and you certainly don't, right? You want to get back on the path as quickly as possible.
Yeah.
So I think that's, you know, that's fantastic in itself. And what about your website? You know, if people want to look again?
Yeah, it's www.livinglegendshealth.com.
All right, and the McGuire Group, Absolut Care, and Living Legends Health are all combined as one, so people aren't confused. They're all one group, correct?
All one group.
All right, very good. Thank you very much. We appreciate it, Aaron. For more information and answers to your questions, contact McGuire, the McGuire Group, and Absolut Care by calling 1-800-826-2013 or go to livinglegendshealth.com. Sponsorship and promotional considerations for the preceding segment was provided by Living Legends Health. And join me weekday mornings, 7 to 9 a.m. on the Big WECK. I'm Joe Chilling, mornings from 7 to 9 on Buffalo's oldie station, the Big WECK. Joining us on the Big WECK Buffalo on the Rise today is Jonathan McDonnell from BAM Acupuncture. And Jonathan, we should mention Buffalo Advanced Medical Acupuncture.
Exactly.
I don't say that. I don't say that all the time. Let's talk about who listening, who viewing out there can actually use your services, do you think?
Yeah, absolutely. So, I mean, obviously we're an acupuncture and integrative medicine clinic. The patients that we tend to help or that tend to gravitate to us, we really thrive on the complex cases. You know, so patients that come to see us tend to have exhausted all conventional treatments. People that are kind of losing hope, you know. Often I'll have patients come in and they'll sit down and they're like, look, I don't know if you can help me. I'm here just as my last resort. I've been told I just have to learn to live with this. So I would say in general, if you've been told like there's nothing we can do for you, you just have to learn to live with this, you should make an appointment and come see us, because often that's not the case.
When you start thinking about age, you know, when I hear you say someone comes in and says this is a last resort, it automatically makes me think of somebody older. Is your clientele generally older, or is it all ages?
All ages. I mean, last year we had our youngest patient. I think she was 12.
Really?
Yeah, I mean, that is definitely more the exception than the rule. I mean, you don't tend to get like neurological problems at 12 very often. But yeah, I do think our patients do tend to be older. Reason being is like these chronic diseases, when they start, usually it's not a problem, right? You can manage it, you can just keep plugging along, work your way through it. But eventually these chronic problems do catch up with us, and that's, you know, if we're fortunate enough to live long enough, that's when it happens.
It would make me think, this is a generalization now, that your clients are more male than female, because I would think that males have a tendency of saying, I'm just going to wait, you know, And a female is much more attentive, if you will, to their health, I think, than some of us guys.
That's true. I mean, when I think it's a pretty even split between men and women. What I would say is it's a different motivation. The men that come to see me, it's more like, I want to get back on the golf course or that kind of thing. Women, it's more, I'm having pain and I don't want to deal with it. Men, it's really got to limit your manliness, I think, a little bit before you actually do something about it. Where women, they're definitely more proactive.
So what do you think, I mean, I know this is going to be a difficult question, but what do you think is the most common thing that you treat?
Oh, hands down, peripheral neuropathy.
And explain what that is. I mean,
Well, there's a lot of different forms and varieties of peripheral neuropathy. It's kind of a very broad term. But anytime you have dysfunction of the nerves in your arms or legs in the peripheral, we classify that as, or Western medicine classifies that as peripheral neuropathy. And there's different, manifestations of that too. We see a lot of like chemotherapy-induced neuropathy. One of our patients, Phil, unfortunately, as he got older, he developed non-Hodgkin's lymphoma. Battle of his life, and he won, but he was left with like numb hands and feet, couldn't feel his hands and feet. So he came in for treatment with the motivation that he really, he's a woodworker. He wanted to help his grandchildren, and teach them how to do these things. But he was finding that he was dropping the tools and he couldn't find the screws and that kind of thing. So he came in for treatment. One of the things about chemotherapy-induced neuropathy, once that drug is gone, we can alter the course of the nerve, the health of the nerve, and he's back to 100%.
What about, and I see this maybe with, with older people, friends of mine or something like that, that will say, I'm warm, but my feet are really cold. Mm-hmm. My hands, are really cold. Is that something that should be a warning sign for them, or something they should get treatment for?
Sometimes. I mean, I would definitely get that checked out. There's a lot of different things that can cause that. And I really can't think of any of those causes that we don't have a good solution for, honestly. And we do, I will get people like Raynaud's syndrome is something I think of when you say that, and that's an autoimmune condition where the blood vessels just constrict excessively when you're exposed to cold. That's something I've been treating for years, and that you kind of run the gambit. That sometimes can hit younger people, sometimes older people. But that doesn't necessarily mean that's what's going on. I mean, that can definitely be a symptom of neuropathy. But the thing when you're treating something like a chronic disease like neuropathy, it is a progressive disease, right? So if you start noticing these symptoms, you come in for treatment right away, usually, that means better outcome, and that means faster results. So yeah, if you're more proactive and you're noticing like, hey, something is different here, I would encourage you definitely to get it checked out.
Except, when I walk, I'm out in the cold, I'll start to feel, like my fingertips might feel cold or something like that. But does your body kind of draw that heat into a center area?
Yeah, that is a normal response, right? That's your body trying to conserve heat, constricting the blood vessels. But in some people, that response is exaggerated. And that's when we say that's more of like a neurological autoimmune type of condition, like your Raynaud's. That can also be an indicator of, just the circulation in general in your hands isn't what it should be. So yeah, it is normal. And what I would say is normal is like, when you go out, your hands should get a little cold, maybe a little numb, but as soon as you get back into a warm condition, that should come back. If it doesn't, then that's something definitely you should get checked out as well.
And type 2 diabetes, can that cause some of these things?
So that's another cause of neuropathy, and that is chemotherapy and diabetic types of neuropathy are definitely the two most common types of neuropathy that we see in the office. And there's a lot we can do for patients with diabetes as well.
So first thing, they should give you a call, right?
Yeah.
Right off the bat, not feel, inhibited or anything like that. You're not going to look down at them. No. You're going to give them some solutions to their problems.
Yeah,
right?
If you think you are a hot mess, don't be shy. We specialize in hot messes. And I say that in the most loving way. Like, people do come in and they're just, I'm just a hot mess. I don't know if you can help me.
Yeah.
But yeah, we're not going to look down on you. It's very simple. First step, call our office at 716-632-2207. You're going to talk to one of our patient care coordinators, set up that consultation, and then you'll sit down with me, and then that's when we'll do the detective work. We'll figure out exactly what's going on. If it's something I can help you with, I'll spell out a really clear treatment plan from beginning to end. There won't be any surprises. You'll know what to expect.
Well, Jonathan McDonnell, if he calls you a hot mess, you know he loves you. For more information and answers to your questions, contact Buffalo Advanced Medical Acupuncture by calling 716-632-2207 or go to bamacupuncture.com. Sponsorship and promotional consideration for the preceding segment was provided by Buffalo Advanced Medical Acupuncture. And join me from 7 to 9 a.m. weekday mornings on the Big WECK. I'm Joe Chile. You can listen to me mornings on the Big WECK. Joining us today on the Big WECK's Buffalo on the Rise is Dr. Kaplansky. How are you today?
Good. How are you, Joe?
Thanks for joining us. I appreciate it. You know, one of the things that I noticed when I was prepping and doing some of the research for the show itself is the fact that there are a lot of national firms. There are a lot of firms that come in now and they're advertising in it. And you know, I always wonder, I like to have local people that I can call on. If I have a dentist, I want to go to the same dentist all the time. I don't want to go to, you know, the dentist of the day, right, if you will. So what sets you apart from like the national firms?
Well, absolutely. So there's a big move in dentistry now is to consolidate, and basically dentists are selling their practices to larger companies. They're called DSOs. And most of the offices that you see out there, even though they might say Dr. So-and-so, they actually are part of a huge conglomerate, and it's a big corporate organization where profit is the most important thing. So we are a privately owned, very personable and local dental office. You always see the same people when you come, and we take good care of patients.
What do you think, you know, we know that you're in Gasport, and to some people Gasport may seem like it's a way off or whatever, but you have people from all over Western New York and Southern Ontario coming to you, right?
Absolutely. So Gasport obviously not the center of the universe, and many people don't even know where it is, but the services that we provide, the process that we invented, and what we do for these patients is so unique that people have absolutely no problem traveling to us from Toronto, from Erie, Pennsylvania, from even Albany.
You say that you can have dental implants in less than a day. Now, is that really true? Less than a day for dental implants?
It does sound sort of magical, doesn't it?
It does.
Yes, the process is really unique, and it uses patients' native bone or native tissue, so we don't rely on grafts. And by doing that and placing implants strategically and kind of joining them together with prosthesis as a brace, we can load these implants right away and give people teeth within 24 hours.
How long did it take you personally to get to the point that you are now, to the teeth now process?
Well, I've been a dentist for 30 years, and I've been in practice in New York for 25 years. And it's pretty much a lifelong journey for me. And every year I just get better, like that wine or cheese.
And there's nothing up your sleeve, right? I want to make sure we're talking about, you know, a magic here and things like that. It is a revolutionary process. Now, it is, you know, you talk about this happening in less than a day. Yes. Traditionally, when we're talking about dental implants, is it something that can take weeks or a month or whatever?
Traditionally, it can take months, sometimes years. So let's say a person doesn't have teeth anymore, and they have deficient bone. They have not enough bone. They would come to a doctor and they would say, well, you're either not a candidate for a procedure or you will require grafting. So grafting takes sometimes months, sometimes years. Patient doesn't have teeth all that time. They just go in toothless and they're undergoing grafting surgeries. Then after grafting, they would attempt to place implants. A lot of times the grafted bone isn't as strong, so the implants cannot be placed. So then you already wasted a whole bunch of time. You wasted a bunch of money. You had no teeth all this time, and now you're stuck with the denture anyways. So a lot of patients experience this kind of a cycle of okay, I'm not getting anywhere with this. I just spend a lot of time and money, and I'm back to where I was with the denture.
Now, when you're talking about dental implants, because I grew up not that I have dentures, but I grew up in the age of dentures. And there was, you just see people, corn on the cob, pushing it out of the way. Apples, pushing them out of the way. Caramels, pushing them out of the way. Dental implants, can you eat all those things?
You can eat anything. With dentures, you're relying on adhesive. So a lot of people buy denture glue by a bucket, literally, and they put it in there, and the denture comes loose while they're chewing. They have to reapply the adhesive a few times throughout the dinner, throughout the meal. Dental implants, the way we do it, pretty much gives you a chewing power when we're done, when the process is all finished. Not only identical to natural teeth, but sometimes even stronger, even better. We measure their bite force, and there's actually an appliance that can measure the bite force. And their bite force is tremendous. They can bite through anything.
I think there were women in my past that really wanted me to fall asleep and then put that adhesive on my mouth so I didn't talk anymore. I don't say that works successfully. Some people are told that they're just not a candidate for dental implants. Well, what's your response to that?
Most of the time we say, yes, you are a candidate. So the way it works again is we place implants into patients' native bones. So most patients that have been told that they're not candidates, the dentist only looks at the area where the teeth would go. We go to the other areas in the face, such as zygomatic areas, which is a cheekbone. There's an area behind the jaw on the upper called pterygoid plate. There's also areas inside the nose that can be used. There's called transnasal implants. So we can do all these things. I'm pretty much the only dentist, the only oral implantologist in this area that is qualified to perform these procedures.
Well, for more information and answers to your questions, contact Dentistry by Dr. Kaplansky by calling 716-772-7500 or go to drkaplansky.com. Promotional and sponsorship consideration provided by the following.
Thanks for watching this edition of the Big WECK Presents Buffalo on the Rise. For information on this and other shows, go to our website, bigweck.com, and find out how you can participate on the program if you're a hometown business. I'm Joe Chili. Thanks for watching and listening to the Big WECK, Buffalo's oldie station.
The Big WECK Presents Buffalo on the Rise was sponsored by Dr. Kaplansky Dental Implants. Get new permanent teeth in 24 hours with our exclusive Teeth Now process.